Eric Feigl-Ding is an epidemiologist, a health economist, as well as a senior fellow at the Federation of American Scientists in Washington, D.C. Joins us live now. Eric, good to have you on the show. Let's start off with the leading country in the region that we're discussing today, the Americas. Here it's the United States. The rollout of vaccines could be happening before the end of the year. What are going to be some of the goals here, both in terms of costs and in terms of the priority in terms of which patients or recipients get it?
Right. And I think the rollout will be very soon after the December 10th FDA advisory meeting. It could be the very next day, it could be a week after. But regardless, healthcare workers are definitely the top priority, followed by other frontline workers, such as potentially, police, firefighters, teachers, that's still being discussed, and possibly nursing homes residents, but that is debatable because they're not essential employees, but they are high risk. So these are things that are being debated of who is frontline, essential, or not. But I think healthcare workers definitely is at the very front of that pack.
Okay. So we're basically talking about the world's wealthiest, world's richest country. The situation south of the border, the situation in the southern hemisphere in South America is very different when you sort of look at not only the, at the macro situation, but also individually as well. In terms of rollout in other areas of the Western Hemisphere, how do you see it sort of playing out?
Well, I think Canada will definitely get access to it very quickly because many other countries who can afford it have done so. The issue is some of the, lower income, middle income countries like Mexico and Central America. I fear like they will be a little bit behind the pecking order, but I don't think that further back because the access to the vaccine is not being limited that much. The production for these vaccines is pretty fast. I think the only limit is the costs, because the Pfizer Moderna vaccines are anywhere from $15 to $25, as well as the cold chain, because this Pfizer Moderna require really cold temperatures. They both require freezing, while some of the other ones in the pipeline, the Oxford AstraZeneca, do not. And it's the freezing cold chain that is really limiting for a lot of these middle-income countries.
Okay, having what you just said, I mean, let's talk about Brazil, because with the Pfizer-BioNTech one, you said it needs to be kept at minus 70 degrees Celsius. It's a country that has hundreds of millions of people, many of them perhaps in remote locations with a very high infection rate and death rate. This must present some considerable challenges.
Right. And to be clear, it only needs to be frozen long term. It can be thawed out for approximately a few days for these vaccines. And so there is a window in which to get it to clinics without freezing at the last stage. But it is very much challenging. That said, a lot of the vaccine trials are actually being done in Brazil. So I think that's also a key thing to highlight. It's not that it's impossible. It just takes a much longer. And I'm hopeful for the AstraZeneca vaccine because that one only simply requires refrigeration. But they're doing a second confirmatory trial for the AstraZeneca. Okay. But I'm very hopeful because that's 8 to 10 times cheaper and it doesn't require freezing.
Eric, one of your many titles, you're also a health economist. And basically, you look at the efficiency and the effectiveness of healthcare systems around the world. I mean, looking at sort of the Western Hemisphere and how each country has specifically dealt with this pandemic, do you think that perhaps that is foreshadowing on how the vaccine will be rolled out, how effective it will be rolled out?
Right. One of the key things is we say in vaccines, it's not the vaccines that ultimately save lives, it's the vaccine rollout programs. And that is the ultimate thing in terms of effectiveness. Efficacy is all this 90, 95%. number that we hear with the vaccine. The effectiveness is how many people will take it. And that number is highly variable because it's sociological. Because right now, a lot of polls say 1/3 of people will definitely take it, 1/3 will not take it, and 1/3 are in a wait and see mode. There's a lot of vaccine hesitancy, and this rollout program involves getting people to take it as well as getting the second shot. And the economic incentive for people, and to remember to remind them that you have to come back for a second booster shot, is what actually will make and break the effectiveness ultimately of this vaccine, in addition to convincing them that the vaccine is safe and you need to take it.
Okay. All right, Eric, I'm afraid we're going to have to leave it there. Thank you very much for your analysis. Do appreciate it.